Right. Welcome, everybody. Welcome to your Justice Involved Collaborative. We do this on a quarterly basis, and this is your collaborative for the month of October 2022. We're glad to have you all with us, and we have some exciting topics to cover today in the next hour. First, I would like to do some acknowledgement that it's beautiful fall weather. So I hope everybody's getting a few moments in their days or their weekends to get outside and enjoy it. Hopefully it's beautiful where you are. And I thought this was a pretty picture, so I put it in there just to give us all a little neural calm for a moment. And we have some very important people with us that are a big part of what we bring to you from the Community Partner Outreach Team and Oregon Health Authority and Oregon Department of Human Services. So I'm Deanna Simon. I'm one of your regional outreach coordinators. I primarily serve Multnomah and Clackamas counties, but I'm also the point person for the justice involved work and for all sorts of other roles on our team. And we have with us today a number of people actually from our policy and operations teams. The first ones I'm going to point out are Christy Taylor and Janelle White from our policy teams. So can you two please say hello? Let's start with Christy.
Hi, I'm Christy. Nice to meet you. I'm with the Magi Medical Eligibility Policy specifically.
Hello, everyone. This is Janelle White. I'm with APD Medicaid Policy.
Thank you. So these are some of our policy folks, amongst others. We also have Brian Kirk on the line today. He's with the General Assistance Program. You heard from Brian last webinar. And we have many people who support this work, a few of whom are with us today. And we also have Beth Fischel. Beth, can you introduce yourself and say hello?
Hey everyone, I'm Beth Fischel. I am the HSS4 lead for the Justice Involved team over at the VEC unit at 5509.
The Virtual Eligibility Center. So what that means for all of you is that when you email the justiceinvolved.5509, that's the branch number, 5509, when you email that team, it is Beth's team of workers who are assisting you. So Beth is a really integral part of a lot of what we're going to be talking about today, in fact. With that, we are going to be using Poll Everywhere quite a bit today to get some feedback from all of you. So I would like to start by getting that up and running. And if Poll Everywhere isn't working for you, then you can use the chat box or the questions box. But we would like to try to get you onto Poll Everywhere because then other people can see your anonymous responses, and that can be really helpful. And it means that your data will be part of the bigger data. And it won't be excluded because it's somewhere else. So to get that going, let's all take a moment to open up an internet window. It's the best way to do it. You can also use your phone. Let's see here. But the best way, you can use your phone to open up an internet window, like on Safari or Chrome, and actually any of the browsers. And if you can type in pollev.com/OliverVera795, you'll be prompted to enter your name. And if you can all do that, you can do it on your computer or on your phone. And if you can verify for me when you have been able to do that into the chat box, that would be terrific. Or into the questions box. Yes, I can send the link in chat. Let's see, can I grab it? I will have to exit out here for a moment. I'm putting it into the chat, not, I can put it in the questions. Give me a moment, everybody. That may not be a direct clickable link, because it doesn't have the www on it. But I think if you paste that into your web browser, it should work. Somebody says their chat is disabled. Maybe because you're on your phone, I'm not really sure. But at any rate, let's test this out. We are going to launch a poll. And you can also text Oliver Vera 795 to 22333. So if you would like to do that instead, it sometimes doesn't work as well, but it is an option. So there are the instructions at the top. Disabled by host. That's interesting. I do see people responding. So if it's not working for you, instead of taking the time to troubleshoot that, you can put it into the chat, but thank you for trying. Okay, so the first question, just to get us used to doing this, is how are you feeling today? A, B, or C? And now we can actually look at responses and see how people are doing. Excellent. Okay, some people are mediocre, so kind of in the middle. Might be something going on. Just want to acknowledge that and say that if you have any needs that you need to take care of course, go do that. We are recording this webinar and we will post it so you can review it later on or share it with your colleagues. All right, we are going to do one more question here. So I'm moving on now. What is one thing you like to do for self-care? I think it's good in these times. A lot of us are getting overwhelmed. We're really committed to our work. We're doing so much. We put a ton into it. And we sometimes, if I speak for myself, have a hard time remembering to take care of ourselves too. So I thought I'd take a moment to ask, what do you like to do for self-care? And are you doing it? Let's see. Let's see what some of the, dance or yoga classes, nice. A friend just invited me to a bar 3 class. I have not taken a walk in a while. I like that. I haven't really been outdoors enough. This is probably a bit of a check-in for myself. And I would love to know what it looks like to take a walk with your cat. Awesome, hot bubble baths, which is good for these cold nights. Oh, pet snuggles. All right, so this is to get us used to poll everywhere, but also just do a little check-in and say, how are we doing and are we taking care of ourselves? I think it's worth asking. Right. You can keep typing in, but I'm actually going to move on right now. Thank you for sharing. All right, we have some exciting announcements to make today, and we want to talk about something that has been reported to us that we are still learning about. It's the overlapping incarceration date error. And then we really want to have lots of questions for a roundtable, or lots of time for a roundtable and question and answer. So what we'd like you to do is type your questions in as we go, and we will try to either answer them or bring them into the discussion so that they can benefit everybody. Before we start going, I would like you to answer another Poll Everywhere question, which is, what best describes your organization? Are you an incarceration facility? So you're working at a DOC facility directly or at one of the local county jails? Or are you with a provider organization that bills OHP for medical services? Or do you work for somebody else? It might be a nonprofit social service organization, but you're not a provider. You don't provide mental health or physical health services and bill OHP for that. So let's see who is here. This is going to help us understand what troubleshooting options are available to all of you as we go through the rest of the content of today's webinar. Okay, so about 50% of you are providers, and about a fifth to a quarter are at an incarceration facility. And for some of you, these may not really be relevant, right? You might work for the state and you're joining us, and that's fine. So don't feel like you have to answer these. But we're trying to get a sense of who has access to things like, I'm going to move on now because I think we're stable. things like MMIS. So now we'd like to know, this will inform the rest of our discussion today, are you, as an assister, do you have access to MMIS in order to check things like the effective dates of coverage for the people that you are assisting? Typically, that occurs at a provider organization, but some other entities also have agreements to have access. So, your options are, yes, I have that access. No, I don't. I'm working on it. So I know that some entities are working on getting access through their organization. And if you don't know, that's okay too. Okay, interesting. So a lot of you do. That's great. That is actually, so far anyway, 77% of you are saying yes. And that's more than I expected. I'm really glad we asked that question. If you're working on it, I wonder if you're with Multnomah County. Okay. All right, I think we're stable on that question now. But Christy, hopefully that's interesting for us. All right, we're going to move on now to our main content, and I'm really going to turn it over to Christy because the main content for today, these announcements and the work behind them, Christy Taylor from our policy team and Beth Fischel from our operations team have really been the ones to make this happen. So I am very pleased to hand it over to Christy Taylor with our Magi Medicaid policy team to share some fun stuff with you, and I'll interject if I feel like there's anything helpful. But Christy.
Thank you. Thank you so much. Yeah, let's dig in. A couple of exciting things to share. So the first one is pretty big change for us. We're removing the 10-day reporting timeframe requirement for reporting releases in practice. And so we're vastly making that more flexible in our business processes. So obviously it's the goal of all of us to continue to get medical restored for individuals as quickly as possible upon the release. That's why we're all here. So definitely we're not suggesting that you wait any longer to report releases to us. However, we're essentially removing the requirement that releases must be reported within 10 days in order for us to restore coverage without needing a new application. So now the agency can restore coverage without a new app or needing to evaluate for good cause for late reporting up to 12 months after a person is released. We can go to the next slide.
Sorry, I was answering a question. Thank you. The next slide should be showing.
Okay, it looks good. So to add then to that, clearly almost all of you like pretty much report within 10 days, so that doesn't affect you, but here's where it may affect you. To go along with that then, since we can now restore eligibility after release for up to 12 months in the past without needing the new application, this means that if a release date for a former incarceration period was never reported, and then you go to report a release date subsequent to that, we can now restore eligibility for that gap of time in the past when the person didn't actually report release to us without requiring a new application. So let me say that a different way. I think this is where it's going to impact some of you. Previously, when an individual had been incarcerated, let's say multiple consecutive times, right? Then, let's say after the first incarceration period, no one contacted ODHS to let us know of their release. The individual didn't know they needed to tell us. Their benefits would have remained closed. So after a second or third incarceration segment, one of you may have sent us a 7100 and said, I'm reporting release for this person. And our eligibility team would see that and say, oh, thank you, but we need a new application because there was actually a previous incarceration segment that we did not get reported release for within 10 days. And so we need a new application. Going forward, we can now restore benefits with the 7,100 you send us. And if there was a previous release that was not reported within the prior 12 months, we can restore benefits for that gap of time. So if I want to take a quick example on the next slide, and I think this will help illustrate as well. So let's say an example, person was incarcerated, Medicaid eligible person got incarcerated on January 2nd through the 15th, so just a couple weeks. Benefits got suspended as of January 2nd. ODHS does not get informed of that person's release on the 15th, so their benefits remain closed. Then that person gets incarcerated again on April 4th. And on May 31st, the justice involved assister sends us a 7,100 to report the May 31st release. ODHS used to decline to accept that 7,100 on the May 31st release and require a full application instead, due to the January 15th release not being reported timely, unless, of course, there was good cause for that. But now, ODHS will restore for that May 31st date that you're telling us about. And we can also go back and fill the gap of eligibility between January 15th through April 4th if we know when that previous release date actually was, and can build that eligibility segment with the appropriate dates. So I want to pause and take questions. I also want to really give a kudos to Tammy Stump, who I believe is on the call today, because she took the time to reach out to our agency and inquire about this as being a barrier. And that is what prompted us to take a closer look at this and try to tear down some of these barriers. So hopefully this will be of assistance to you. Are there any questions about this segment?
We have a question. A lot of whoop whoops and yay, this is great. And here's a question. Can we submit dates for both bookings on the same 7,100, or do we need to submit a separate 7,100 for each booking?
Beth, what do you think about that?
I was actually just going to interrupt and say that if you believe that someone may not have been restored for a previous incarceration, if you want to include those dates on the current 7,100, it just helps prevent clutter in the box. Just make it as clear as possible. You know, we believe we may have missed this. Jane was released on May 31st. Jane went back in on, looking at our example, Jane was released on January 15th, and then Jane went back in April 4th and was released May 31st. Please review. Just something like that, just so we know that you're trying to fill that gap. We will definitely look for those dates to the best of our ability, but in the interest of efficiency, we're not going to be able to call a facility every single time and get those.
I would say too, it is really helpful if you do know the dates, because we, like Beth was saying, sometimes we don't often see them in our electronic source systems that we have access to. Those previous release dates, they're gone, like they're not visible to us. And so a lot of times the only way we can fill a gap of eligibility is either by trying to reach, by calling the facility, or if you're able to see that in your system and report it to us, that's super helpful. All righty then. Any other questions on that before I move on?
Gosh, I had a question that was a follow-up question that occurred to me, and now I can't remember it, so I will see if I can conjure it. Are there any other questions? I don't see any other questions right now. Oh, I know what it was. When is this effective?
It's immediately. It's already been communicated to eligibility staff.
But last week, if you may have gotten pushback and been asked for a new application if it was past 10 days, right? So this is brand new, just going into effect. And yeah, thank you.
Yes.
All right, we ready to move on?
Ready to move on. All right, exciting topic number 2. we'd like to offer all JI assisters now the option of early submission of 7100s and full applications when they're needed to the email box as part of your normal process. Our system will allow us on the worker portal side, not the applicant portal side, to enter future effective release dates, and the system will give a future effective medical start date against that release date you tell us. So because of your role as a JI assister and your very close working relationship with accurate release date records, that's part and parcel why you have the distinction that you do. We will take the future effective scheduled release dates that you know up to 30 days in advance, and we'll enter them in our system. And we will allow eligibility to start an MMIS effective that day. This is kind of a big change. We're hoping it will relieve some of the burden of urgency to wait for the actual day of release. So when you send those, our staff will enter those in the system, and keep in mind that CCO enrollment still occurs on a weekly cycle once MMIS eligibility actually starts. So as of the release date forward. So that means they're not going to be necessarily enrolled any sooner in their CCO. They're not going to start on day one being enrolled in a CCO. They'll still have to be picked up in the weekly enrollment cycle. So it'll be another 7 to 10 days after their medical starts before they're assigned to a CCO. But this is a big change. We can go to the next slide. And I just wanted to take a second to point out just some of the benefits of going this direction. So again, I want to say this is optional for you. I know that not all of your business processes would allow you to do this because you don't actually see people until they're actually released, but some of you may have the ability to. So benefits of restoring scheduled releases up to 30 days ahead. I think we could all brainstorm some benefits of this. It's a good move. You all don't have to collect applications and wait until release to submit them. Some of you are holding them. You're gathering them and then you have to hold them. And if the person's released on a weekend, for instance, you may not be able to report them to us until you come back to work on Monday morning. So maybe that's caused a delay in getting their benefits restored. So members will no longer have to wait for their assister to return from a weekend or days off or whatever in order to get coverage restored. Also, ODHS staff will have fewer urgent release notifications to process on the day of actual release, and they'll be able to ensure more timely processing then of all submissions that come into their email box. It's always a priority body of work, and they've been able to stay on top of processing quite well, but the more we can get processed ahead of time, the less they have to do on the day of with as much urgency. Also, members will have access to medical that's turned on and ready to use the day that they walk out. And a lot of times we know they need access to immediate services. Prescriptions are a huge one. A lot of people go directly into treatment or what have you. So the benefit is we can have their benefits open and going the day they walk out. Let's see. Let's go to the next slide.
We do have a question. So after this slide, let's take the questions.
Yes, I just wanted to finish this last section. So important note, if you would please, if you're going to send us reports of release that are in the future, we will process the eligibility according to the release date you tell us. But please, you need to then also monitor that that individual actually gets released on that scheduled day. And if not, please notify us to correct our eligibility start date accordingly. The state can get in a lot of trouble if we have medical coverage open while individuals are still incarcerated. So we need to be sure that our incarceration start and release date records are correct. And we really need your help in managing this well in order for this process of early submission to work. So right now, this allowance to report future effective release dates is only being permitted for justice-involved facilities and JIS sisters, because we trust that, again, by the nature of your role, you have direct contact with facilities and their records in order to report dates correctly to us. But we're interested to hear if you think this process will work, or if you anticipate any trouble or any other barriers with this. Obviously, it's new, so we're very open to any input you have to share with this allowance, and whether you think it's something you can use, or if you have any other questions about that. So I will open it up to questions or comments at this point.
Yep, here's
I
a
do want to add
question.
one thing real quick before I thought about this at 2 in the morning when I took the puppy outside to go potty. When you're sending a pre-release to the justice involved email box, if you could put in the subject line that it is a pre-release, because we want to make sure that we are still prioritizing the people that are leaving that day, and that a sister isn't able to utilize the pre-release process. We try to go in date order as much as possible. So we don't want to miss somebody who's leaving today to process 12 people who maybe aren't getting out for 3 weeks. So just for right now, pre-release in the subject so we can work accordingly.
Thank you. We do have a few questions here. And one of them, here, I'll just read it. If the release date ends up being different, how do we, I'm just going to read it. If the release date ends up being different, is it easy to update that, or is there a parameter about how many days it can be off? The claims would deny for us due to location.
So it is easy to update. There is no threshold of days. It needs to be exact. So if it's off even a day or two, we'd like you to contact us. Just email the box and just correct the release date.
Beth, do you have any guidance for how assisters interface with your team through that email box about changes to the release date?
I would suggest, if the date is different, to attach the original 7100, since all the pertinent details are in there. And then just in the body of the email, just say, correction to dates, whether it's earlier or later, and then we can make those corrections and notate the case.
And we can add that to the guidance here. In fact, I think we'll need to update our guidance in general about the justice involved process to accommodate these changes. So I'm making a note of that. Do you need anything in the subject line to indicate that there's a date change?
Date correction. I mean, just so we know what we're working with, that would be a priority. I mean, because we definitely want to be in compliance with the rules. So I would say date correction in the subject line would be beneficial.
Noted. Thank you. I do see another question here. It's about our previous topic. If we submit a 7100 post-release for dates that weren't yet caught by OHA, meaning the client still has active benefits, will the CCO be cut off or reinstated with processing? I'm working on interpreting.
No, they actually don't. What will happen is we will correct that previous segment of eligibility, but the CCO enrollment ongoing would not be affected. We would go back and we would recoup an incarceration segment of time in the past if there was one. So it should not affect ongoing enrollment.
So if somebody is released, they were never suspended to start with, we'll correct it in the past, but that may mean for that person, they actually end up enrolled in that CCO right upon release because they were never disenrolled. Is that
Right,
true?
they would
Is that
just remain enrolled, right?
right?
They would
Okay.
remain eligible and enrolled the whole time.
Mm-hmm.
And it's important to note if that scenario happens, we can't remove them from a CCO, so they could be admitted to a facility that only accepts open card. We have that come up occasionally, and it can get pretty tense.
That's a great reminder, Beth, to the fact that when somebody goes into an inpatient facility for physical inpatient or substance abuse or mental health inpatient, that their enrollment, whether it's in a CCO or on open card, gets locked at that time for basically for the duration of their stay with some check-ins there. Right? And we did a webinar about that some time ago, but that is an important note for those going to inpatient treatment to make sure that gets managed and looked at. There may be some questions about that we'll save to the end. If they are released another date, would we submit a new 7100 or just update the date with an email? So Beth, that's for you. When that date changes, it sounds like you just need the old 7100 re-forwarded with notes about the date changes. Right? Is that what we heard?
Yes, I mean, Christy may have a different idea on it, but for me, the more we upload to the electronic case file, where where we house all of the documents we receive, the more we get, the messier it gets, and the harder it is to find stuff. So it's just much easier if we have that original and we can make good notes.
Okay. Here's another question. Do you know if this is the same process that Oregon State Hospital, BCU, uses for forensic patients, technically in custody? Do you know if Oregon State Hospital starts a process, can I go in and enter a release date from custody? This might be an offline discussion. Is this something we should talk about here or take offline?
I don't think we're going to do it in chat back and forth. If we open a phone line, perhaps we could have a discussion. I think someone even may be here from OSH, but
Let's discuss this offline. I'll put in my email. All right. And somebody with Clackamas County is already testing this, sending their first pre-release email. So let's see how that works. Okay.
I've shared it with my team, so if you happen to get any pushback or what the hex, please feel free to reach out to me. We've been in training, and it's possible someone may have missed it, but the information is available to them.
Great. So we would love just some feedback here about who might take advantage of this early submission permission. Yes, no, sometimes, or not sure yet. Those are your options. Hopefully that poll has launched. I only see one person having responded to it. I know some of you responded in the chat box, but if you can respond here as well. I do wonder if it's working because I only see one result, one response. Let me unlock it. Nope, it's unlocked. Wonder what's going on there. One person won't, that's okay. I wonder, let me look in the questions box and see what might be going on with that poll everywhere. There's a lot, Beth and Christy, I hope you can see this, but there are a lot of notes of appreciation in the questions box for these announcements. And Beth, we have special kudos to Barb, being great to work with. Somebody's seeing a different question on poll. Somebody's still on the overlapping question, and poll is stuck on the previous one. Interesting. Well, let's see if we can get that to move somehow. Bear with me. All right, let's just move on to, do you foresee any barriers to submitting 7100s or applications early? Let's see. Okay, this poll is working. Not sure yet. I don't think so. This is going to help drastically. Terrific. No barriers. It's just not within the role of our organization. Okay, fair. A great idea and benefit for clients. Sometimes we don't see updates until day of. That could be, yes, that's something to talk about. Incorrect dates. Beth and Christy, do you want to talk about the challenge of incorrect release dates, how often those change, and maybe even if somebody who said incorrect dates, if you can put into the questions box who you are, and maybe we can unmute you and have a little discussion about that. I think that would be worth discussing.
Yeah, the biggest thing for the state, we're at high risk if we make any payments on someone's behalf while they're still incarcerated. So what we're trying to prevent against is having eligibility and paying while someone's incarcerated and paying claims, which is very unlikely to happen if they're incarcerated. But moreover, making payments as in on their behalf for things such as CCO capitation. We pay to enroll them in a CCO, for instance. If they're still incarcerated, that's when we get in big trouble because we're making payments on behalf of someone who is incarcerated and not eligible for those payments. And so the biggest thing for us from an audit perspective and a risk perspective is keeping the incarceration start and release dates as accurate as possible. And therefore we can prevent erroneous payments from going out for anything on our payment side of MMIS.
Onesimo and others, maybe like Onesimo's with Benton County, the main barrier is having clients that get their release date moved up before we are informed.
The best I can say in those scenarios is tell us what you know when you know it, and then as soon as you learn differently, you can tell us again. And that's no different really than what would happen today, I don't think. As soon as you learn of it, you would probably send us the 7100s, and that's when you would be processing them, right? So it happens, and I'm not sure we can do much about it other than just to try to be responsive to it.
Thank you. Beth, I think you might have already said this, but I'll ask you to say it again, mostly because I'm not sure I heard it, and there's a question, which is if folks are working with staff and they feel like whatever the staff are doing are not in alignment with what we just announced, such as reinstating without a full new app or sending something in early and getting pushback, how do they escalate that or bring it to our attention?
Well, I check the box pretty regularly. So if you're having an issue or I start seeing some back and forth, I actually read those to see where our issue's coming in. But you can definitely email me directly for those concerns, or in the JI box, you can put attention Beth, and the team is great about handing it off. So
maybe that's the best way, to attention Beth.
Yeah, I mean, I checked the box, like I said.
Let's see if that works. And if that doesn't work, I am your contact. You can reach out to me, Deanna Simon, and let me know, and then we can work on evolving our process. This is all very new, and sometimes when new things come out, there can be kinks and things to work out, and we acknowledge that. So that's okay. You can let me know if things aren't working as we hope, and we'll work on it. All right. I'm going to move on then. And we're going to talk.
Those pre-release emails coming in already.
And I think what it means for all of you as Justice Involved Assisters is that we are now asking you to keep track of that, right? Who have you already submitted an early submission for? And how do you make sure that you alert us if that changes? So that's really a responsibility that now we're putting on you. We think it's worth it, and we hope you do too. And if that is useful to you, you'll use it. And if it isn't, it's optional, right? You don't have to use it. So only if it helps you. Okay, we're going to transition now. Feel free to ask any more questions. We can still answer them, but we're moving on to our next topic, which is the overlapping incarceration date error. So first we'll describe what we believe happens, and then we will ask you some questions about it. I'm going to turn it back over to Christy, I believe.
Okay, thank you. Yeah, so we've talked about this before, but we did think it might be worth mentioning again and getting some more feedback about it. So sometimes when community partners go to enter a full application in applicant portal following a person's release from incarceration, even if the incarceration was some time ago, they will get a hard stop error when entering the application, indicating that that person has an overlapping incarceration record. And so why does this occur? We've done our best to start looking into it the best we can. We do have a fix that's sort of lingering out there in line to get addressed in the system so that we can start avoiding this, but that's not prioritized yet. But what we think happens is that if a Medicaid recipient goes to jail, we add an incarceration start date record in their worker portal case, and that is what effectively ends their coverage while they're incarcerated. And then when someone later submits a new application through applicant portal, one asks for another incarceration start and release date, attestation, if you will. And when the two incarceration start dates don't match between the old worker portal case and the new one that's being entered in applicant portal, the system, we believe, is seeing that as two separate overlapping, if you will, records of incarceration, and it says I can't proceed because it thinks it wants that worker portal record completed with a release date instead. So when this occurs, the best thing we can advise right now is to call in for assistance. An eligibility worker will then go into that old record and can manually add the release date to that record and ensure then that the incarceration record dates are correct going forward. We know that not many of you actually enter applications directly in applicant portal for releasing members. Usually you're reporting through the mailbox because that's your primary role. So we wanted to mention it, even though we know it may not occur too often for you. But the next slide is another poll everywhere question, just to see how often you do encounter that overlapping incarceration date error in applicant portal.
Right. We would like to know how many of you are experiencing this. So hopefully the poll is working. Looks like it already works. There's 17 results already. How often do you encounter this error? For some of you, it's still stuck. I'm not sure what to say about that. I'm sorry if your poll everywhere is still stuck. You can type into the questions box. We'd love to know who is experiencing this error. And let's look at the responses here. Most people are saying often, and a few answers in the questions box that say seldom, no, and sometimes. So that's helpful to us, as we weren't really sure how often it's happening out there. All right. Back to Christy.
I'm coming. I couldn't get off mute. Okay. So what can you do? The reason we asked earlier about how many of you have access to MMIS, interestingly, the number was much higher than I anticipated. It's because there is for those of you with MMIS access, there is something you can do to get a hint about whether you can anticipate running into this error or not. You can run a query for eligibility within the month that you think their incarceration period actually started originally. If it's within the past year, you're able to query back a year. And look for the date that their coverage ended, their last date of coverage. And if it ended in a mid-month date, that's very likely the first day of that incarceration period, because we really do not otherwise, except for death, end eligibility on a mid-month date. So when you see a mid-month closure or of eligibility, a termination like that, that's a very good indication that that's because of an incarceration. And in those situations, you can consider going ahead and submitting a 7100 with a pretty safe assumption that that person actually is suspended and can simply be restored with a 7100. Something to note, if the coverage in MMIS ended on the last day of a month, you'll be unable to tell whether it was really due to incarceration or perhaps another reason, because a lot of our eligibility may end on the end of a month for a lot of other reasons. So that's harder to make that leap of assumption in those instances if you're trying to rely on MMIS as an indicator. So in those situations, you might submit a paper application to be safe. And let's see. We can go to the next slide.
Yeah, and let's see. I have a question about this before we go to roundtable and open questions. For our couple questions about this. Number one is, are people who have experienced this, are you doing workarounds that are therefore decreasing the occurrence of this error? Are there any workarounds or solutions that you all as savvy assisters have figured out that we should know are working? Because that could be a clue. This is something that we're still trying to, like Christy said, trying to remedy. We know that our guidance here may not be complete. So we're fishing here and trying to listen for what else we need to know that we might not know. So I'm going to go back here. Actually, no, I'm not. This is just something where you'll have to tell us in the questions box. We don't have a poll everywhere for it. And I'm not, can you just give me a yes or a no? Like, have you found a solution to this, the overlapping incarceration date error? If you're experiencing it, if you have experienced it, have you found a solution? Or do you just struggle through it? You can give me a yes or a no in the questions box. Okay, no solution, it means that we have to call OHA. Well, it's actually ODHS that you're calling, but that's okay. Sometimes we don't know the difference either. Calling in works best. I've just been calling. I had a solution a while back that Alicia Morton and Sarah Carton over at Multnomah County were working on, and she will forward that email, the long email that I clearly need to be refreshed on. So I think mostly people are calling. This concept of finding that accurate match date for the start of incarceration, is this a solution that you feel, I mean, this is why we were asking about MMIS access, right? 70 some odd % of you said that you have access, so that's good. For those of you that don't have access, we know that's not a solution. All right. So we have I'll let people type in any responses there, but that's what we have for right now. And I predict that this will be an ongoing conversation that evolves and that we'll be bringing back to you during future collaboratives. Christy, I have a couple questions here that I flagged in the questions box that I would like to call out. Let's see. Whoops, we already did that one. Bear with me all while I go through these questions. There's a lot of comments in here. Oh, here's one kind of workaround, and maybe we can speak to this. When the one system auto enters incarceration, sometimes I change it to residential, like their current residency being in home. Is that what you're? I'm not sure what you're saying there. If you can clarify it. And Christy or Beth, maybe you understand this better than I do. Sometimes when the one system auto enters incarceration, I change it to residential as current residency.
By auto enter, do you mean like the system captured the incarceration record or the date that it's defaulting to when you're doing your data entry? Because incarceration records are always manually entered. It's not something the system catches on its own.
Yes, it auto-populates as incarceration.
So it's pulling that information over from the existing case, and that's where the error is coming from.
It sounds like it. I'm wondering, yes, Zola says yes. Is that, gosh, is that something we should talk about offline or talk about here?
Yeah, I think it might help us understand what's going on in the system. So I think the feedback is great. We can talk offline.
Okay, great. So
And that's also a good flag that maybe the 7100 would be valid. If it's pulling that date over and it's within 12 months, it's probably something we could look at, and you might be able to stop where you're at and let us know.
I think that's the big message, is that if you get that error message, it means that benefits have been suspended. That's what we believe it means. And that a 7100 would then be appropriate, right?
I'm going to go out on a limb and say not every single time, because if, they happen to have been in jail over that 12-month mark, it may be something we need to look at. It could be that one-off situation. I just want to say that if you're in doubt, submit the paper application. I mean, I know that's not ideal, but in order to prevent back and forth and perhaps missing a release, they're already gone and we needed something else, it can't hurt.
That definitely is the long and short of it, is that if in doubt, a full application will give the justice involved team everything they need to move forward, regardless of what the situation is. And hopefully for the folks who are releasing from custody, hopefully a lot of those applications are simpler rather than more complex with big families. And but that is what gives the justice involved team everything that they need. All right. Can you please type in your questions into the questions box if there are more? Let's see if I...
Can I address one that I see?
Please.
There's a comment in here about a workaround that someone had used in that when they were entering the application and they hit the error, they would go back and mark no, that the person had not been incarcerated, and therefore it didn't prompt asking for start and release dates, and it let it go through. I really want to caution that though, because what that's going to do is the system will just give eligibility based on normal eligibility logic, like back to the first of the month of the date of request month and all that. And if that overlaps with an incarceration period, it could result in giving eligibility when they really should not have it. So I understand that works, but it's really probably not a process we want to use.
Thank you. I do have one more question here that I think is important. Somebody mentioned that they've heard about, in the future, possibly people not being suspended while incarcerated and keeping their benefits open while in jail. And that is part of the waiver work. That is a long-term request. So these are not to replace that request. These are to fill the gap in the meantime, because we had the ability to make a change and make some positive benefit while we're waiting for those bigger picture changes. And we have a follow-up question about what Christy was just talking about. Is that the case, Christy, even if the booking date was already input?
If the booking date, like their start date then was already input. I'm not sure what that means.
I'm not sure either. I think we might have to follow up. I'm also looking at the time. It is 11 o'clock. And a couple quick things here. Sometimes when folks are in jail longer than 10 days, they don't get suspended. This is true. That depends on some factors. So if people didn't get suspended, we still hope that you alert the Justice Involved team with the 7100 so they can correct the past dates and have it accurate in the system. So I am going to call it at that for time, just respect everybody's time, but I'm going to stay here. Feel free to type in some questions and I will take them to our policy and operations teams and see if we can get them answered afterward. So thank you very much for being here. Thank you for all of your questions. Please reach out if you need anything and have a wonderful Tuesday. And thank you so much, Beth and Christy, for all of your work and for sharing.
Thank you.
Oh, I have one more thing. Sorry, guys. I will be getting a recording of this webinar and sending out the slides afterward to everybody as a follow-up. So stay on the lookout for that and feel free to share with your colleagues. Take care.